watching this video, it probably means that we've shared with you that you need to have a tooth removed. Now, I know that this is everybody's worst fear, right? Everybody dreams about this nightmare, has nightmares about having a tooth removed at the dental office. So I want to give you some information so that you know what to expect, so that you don't have to have quite that high level of anxiety about what's going to happen when you come into the dentist. In the olden days and in the movies, they always show it being this horrendous operation where the dentist has his knee on your chest and he's yanking and pulling and your head's moving every direction. And I've had people share this with me. Oh yeah, his knee was on my chest. I have yet to meet the dentist that ever put a knee on the chest. I always think that this is funny. And I have yet to put a knee on the chest. So we've had to figure out some other ways to do it because we don't do the knee on the chest method around here. One thing that we believe in strongly is that even though the tooth is infected, we need to keep the bone that surrounds the tooth there, because the bone is what makes it possible to replace that tooth, whether with a dental implant or with something else, at least to hold that jawbone area and keep it healthy. You need to keep the bone there. So oftentimes during a very not gentle extraction method, a lot of that bone will be lost. So we are very careful, very patient. We move slowly and gently when we remove teeth. And I always tell people I have ways. People say, oh, you're so small. How do you take teeth out? It's not about brawn. It's not about that. It's about finesse. And gently removing that tooth so that we preserve the root around, the bone around the tooth, so that we're able to keep everything in the area healthy. Once the tooth is removed, what we do is we make sure that we get everything out underneath, because that's the reason that you took it out to begin with, right? Is the infection that's underneath. So we use ozone. First of all, we use ozone in a saline form, which will get it in and around and get everything cleaned out, all the bugs, anything that might be in there cleaned out. Then we use ozone in a gas form. And I love using ozone that way because it's interesting how I can see things better once I've used ozone gas. Everything just clears up and I can see little pieces of ligament that I need to remove, little pieces of things that are in there that I just need to clean out and make sure that we get everything out, because that's where the bacteria are living. That's one thing that we always make sure to do, is remove what's called the periodontal ligament around the outside of the tooth so that the body knows tooth's gone, now I'm able to heal. So we also use a laser in the area. That laser energy penetrates and helps that body to heal quicker. And then we fill it up with what's called PRF. Now you probably are going to watch my video about PRF. We'll explain a little bit more in detail, but in essence what it is, it's material that comes from your blood, from your own stuff, so that your body recognizes it and accepts it better. And we fill that hole with that PRF. Then we stitch it closed, and you're going to take a little while to heal. Now people will say, what should I expect during healing? Well, you should expect that you just had a tooth pulled. And take it easy. This is your ticket to put your feet up, to have somebody wait on you a little bit. Take it easy. I don't want you out walking the next day. I don't want you out running marathons. I don't want you out doing anything. I want you to have your feet up, and I want you to take it easy, because your body needs everything it's got to be able to heal. There's a hole in your jaw, right? So it needs to be able to heal that. So you're going to take it easy. You're going to take it easy with what you eat. You're going to take it easy with what you do, and you're going to take care of yourself. You're going to feed yourself good food. You're going to feed yourself good supplements so that you heal. And it is going to be a couple days before you feel like you're 100% again. So plan for that. Expect that. Take a couple days off work perhaps if you need to, and plan for that. Now you're not going to be in horrible pain, anything like that at all, but you're going to want to take it easy. So hopefully that gives you a little bit better idea of what to expect while you're here, and also once you get home, for how to take care of yourself once you've had that tooth extracted.